Good afternoon, ladies and gentlemen, esteemed colleagues and speakers, parents and students. I am delighted to welcome all of you to our live webinar on transforming your dreams into reality as a dietitian. My name is Dr. Lee Yi, a senior lecturer and dietitian at the International Medical University, and I will be your moderator for today's event. Today's talk is one of the live talk series brought to you by the International Medical University's School of Health Sciences, Bachelor of Science Honours in Dietetics with Nutrition program. We are excited to have all of you here, including future students and their parents. Before I introduce our three speakers, I would like to go over a few housekeeping topics. We have muted the microphones for all attendees to minimize background noise. We also invite your comments and questions. Please look for the Q&A panel located on the toolbar at the bottom of your screen. If you think of a questions for the speakers at any point, type it in the Q&A panel and I will pose it to our speakers at the end of the webinar session. Also, today's live webinar will be recorded. So, without further ado, let's embark on a journey of turning aspirations into achievements. On this fine afternoon, we have the privilege of having three speakers here with us to share the valuable insights on this captivating subject. Mr. Nathaniel Keshan Rajah, who had just graduated from the Bachelor of Science Honours in Dietetics with Nutrition program, Ms. Yvonne Lee, who is currently a final year student with the program in IMU, and last but not least, Ms. Lim Jing Rou, who was a credit transfer student at the University of Newcastle, Australia. At this time, I'm going to hand the floor over to Mr. Nathaniel Kitchen Rajah, who is going to start today's presentation and lead us through the captivating journey of transforming dreams into reality as a dietitian. Kitchen is all yours.
Thank you very much, Dr. Lee. So, like Dr. Lee mentioned, good afternoon, everyone. My name is Nathaniel Kitchen, and like Dr. Lee mentioned earlier, I recently completed my studies in IMU last month, and I'll be starting my work as a clinical dietitian in a private hospital in Klang Valley next Monday. So, why dietetics? My pathway is not very conventional. I actually studied 3.5 years in a medical school in India, and during that time, there was one particular subject that I thought was very interesting, and very impactful. It was called community medicine or preventive and social medicine. We did learn briefly about food, about nutrition, and how there are risk factors about chronic diseases like diabetes, high blood pressure, certain cancers, obesity, but I felt it wasn't enough. I used to actually see patients coming back repeatedly after being discharged due to poor management of their chronic diseases. So this was something that actually perturbed me a lot when I was in the wards. For example, there was a patient with obesity and underlying diabetes who kept coming back for various reasons during the 8 weeks that I was posted in that particular ward. So first, she was admitted due to diabetic ketoacidosis, which actually is a serious complication of diabetes. She was treated and sent back home. 2 weeks later, she came back for a problem called gluteal abscess. After a minor surgery, she was sent back home, discharged. And 3 weeks later, again, she was readmitted due to hypoglycemia this time, which is low blood sugar levels, another serious complication of diabetes. So when we dug deeper, all of it stemmed from her poor nutrition knowledge as well as poor understanding of how to control diabetes, because everyone was just giving her medications without teaching her anything. This is Hippocrates. He is famous for one of his sayings is, "Let food be thy medicine and medicine be thy food." So from 2000 years ago, he did acknowledge the importance of healthy eating and how nutrients in various foods had healing properties. So I made a decision during that time. I did a lot of reading and wanted to do something whereby I can have an impact on people from an earlier stage of the disease and perhaps even screen them before they have symptoms, as well as to create awareness among people. Hence, I switched to dietetics. So I thought this was actually quite funny, this picture. A lot of times people just think that the only thing that dietitians learn and do are actually weight loss and, to write meal plans. But there's actually so much more to it. We actually learn biochemistry, microbiology, pathology, pharmacology. We do research as well in our third year. We learn psychology, which is very important in, counseling our patients. So there's so much to that we actually learn. So in a nutshell, what do? We provide or we use evidence-based practice to help treat people with various underlying chronic diseases by using medical nutrition therapy. So from my observations in the past, the doctors are often bogged down with so much work, especially in the public hospitals. They lack the time to give much health education and also, the expertise in nutrition knowledge to teach their patients. Hence why I chose this field. And after going through my internship and finishing this course, I have no regrets. So the past 4 years in IMU have been wonderful in harnessing and actually sharpening my skills and knowledge to prepare me for the real world out there. So the next few slides, I will just show you some pictures of what I experienced during my internship. So we have a 1-year internship. So it starts at the start of our 4th year. So I'll just walk you through it to show what we actually did during our internship to help us prepare for the real world. So we started our internship with our food service management placement. Over here, we got to work under a food service dietitian at a hospital. So from this part, it was quite interesting because this food service dietitian is involved in the kitchen and food service in and around the hospital. We also got to experience what the other food service staff got to do. So those people who would then be working under dietitians, we got to experience that. So this picture is of me and my group mates who we were doing a pilot testing for a new menu for the hospital. So during that time, we had to actually prepare the food, plate them, as well as to justify the ingredients that we were using for our new menu. Apart from that, we also had to give some training to the food service staff or the kitchen staff regarding food safety. Here's a picture of us discussing or preparing for the food service training. And these are our happy faces after we finish the food service management placement. So next would be our clinical posting. So we started off with a 2 weeks refresher course at IMU Bukit Jalil campus to prepare us for the hospital. We had a white coat ceremony to kickstart the clinical placement. And this is my batch, all fresh face before we actually started our clinical placement last year. So this is the hospital that we actually go to. Most of us are posted here. It's the Hospital Tuanku Jaffa in Seremban. I of course can't take pictures of actually the hospital in and around the hospital. So this picture is actually on our last day of our clinical placement with our local preceptors and as well as our clinical instructors. And this is a picture in front of the clinical campus in Seremban. So during the clinical placement, we also got to do other things, So for this, I had the opportunity to also take part in this health screening activity organized by IMU Healthcare or IMU Cares. So during that day, I did a consultation and also as well as counseling for over 40 patients or 40 people. Of course, we did not study all the time. There's very important to have a balance in this. There are various sports activities that we had in IMU, and this was the Goodwill Games in the Seremban campus. Next was our community dietetics placement. This was very interesting as well. I was posted to KK Ampangan, Klinik Kesehatan Ampangan in Negeri Sembilan. It was a good experience because during that time, it was during the Ramadan and Hari Raya period. So there were various activities planned for the patients in preparation for the festive period. So this is a picture of my batchmates and I with our local preceptor just for an event just before Ramadan, where we got to teach patients on how to eat and how to control their blood sugar levels during the fasting month. We also gave a few talks to the local community around Negeri Sembilan area. So this one over here was a talk to pregnant mothers with gestational diabetes. So the preparation and participating in these events would actually help you in the future, I would say, because there are many instances whereby we have to actually go out to the community and give talks as well. We also had a specialized focus area placement. So this is actually up to us where to choose. There are some of my classmates who actually chose hospitals in Taiwan. So they got to experience how it was like to work as a dietitian over there. During my specialized focus area placement, I did it in a private hospital in Klang Valley region. And I had a chance to also give a refresher course to the food service staff over there, in addition to both seeing inpatients and outpatients in the hospital. We were also involved in a health screening event for over 100 people in a Samsung factory in Port Klang too. So there are also further opportunities for you to also present at conferences. There are some virtual ones as well. And this is me presenting at the Malaysian Dietitians Association conference last June. So I presented on a patient that I managed in the Seremban Hospital. Some of my friends also presented about their undergraduate research. So there's definitely an opportunity for you to learn these skills if you're interested. Here's a picture of my batch, all happy and relieved faces after finishing our final OSCE exam. And here, after our exam, some of us were actually involved in setting up the IMU Student Diet Clinic. So it's a clinic that will be launching next month, which will be student-led. And over here, final year students would get to assess, diagnose, and also manage their patients with the supervision of their clinical educators. And these are the amazing people that were part of the team that helped set up the clinic for our juniors. So actually, there's plenty of things that you can pick up from doing all these things from your internship as well as your earlier semesters. It's just whether you're willing to put yourself out there to learn. So with that, I end my talk and I'll pass it to the next speaker. And yeah, thank you.
Thank you very much, Kishan, for sharing your experience. I can see and feel the excitement in your talk. Ladies and gentlemen, throughout this session, we encourage active participation from all of you. Feel free to jot down your questions and reflections as they come to you. We'll have a dedicated Q&A session after the talk, where the speakers will address your queries and thoughts. Now, without further delay, I hand over the virtual podium to Yvonne. Yvonne, the stage is yours.
Thank you, Doctor. All right. Okay, so hello, everyone. So I'm here to share with you my journey to be a dietitian. So hopefully it's a very chill session. So just relax and enjoy the sharing. So yeah, allow me to introduce myself. My name is Evon. So I'm actually from DN120 cohort. So by easy saying, I'm currently a year 4 student. So officially a big tete in IMU. So I'm currently doing my internship for a whole year. So I already done with my food service placement in Sabi Medical Center. So next week onwards, I will be proceeding to the clinical part. Here are some topics that I would be covering today. Hope you'll enjoy it. So first of all, why dietetics? I would say my story is quite different and interesting as well. It has to be start with like back then, a long time ago, where my mom had me for like 5 months. And during that time, the doctor found out that my kidney actually got problem. So it's like one big and one small. The left kidney is not growing anyways. So after I was born, I have to go on a lot of surgeries. After the surgery, I have to go to the hospital for a medical checkup frequently. So from that time onwards, I am very, very obsessed into healthcare professionals. And honestly, I wanted to be a doctor initially. But after I grew up, about 16 to 17 years old, I started to realize that medicine is not a thing that I can handle. It's like too over stress for me. So I started to research on what kind of healthcare professionals I can do other than medicine. And at last, I chose dietetics because of 3 reasons. The first reason is I like food. Who don't like to eat, right? So I like food. That's the first reasons that I choose dietetics. And the second reason is that, yeah, I was educated a lot since I was very, very young. I have to take note on every food I take. For example, I cannot take soft drinks. I can't eat junk food or even food with coloring. I also cannot take. So I have to take note on every food I take every single meals. And the third thing is that I think dietetics is a very natural way which can help people who are in need. Like what Keshan had said, because dietetics, we mainly focus on the earlier stage of the disease, where before it starts or before it getting worse, we are the one who help them to heal themselves using food. It's a very, very natural way. So that's why I chose dietetics. So, but then why did I choose IMU among all of the university? Well, first thing first, I am actually a UEC student where I graduated from an independent high school. So many choices was very limited at that time. For example, I cannot go to government school. So I can only choose for private universities or go overseas. So I started to do a lot of research. Honestly, I am more leaning towards IMU because of the name itself. And at last, I decided to make a visit to IMU so that I can understand more like how's the teaching background, how's the module structure and everything. And throughout all of this, I really love about the background of dietetics in IMU and also the teaching experience that they have, plus the resources provided in IMU. And also by looking at the modules under the course, I can also see that I will be very, very able to enjoy and learn a lot throughout the journey. So without any hesitation, I decided to pursue my dietetics in IMU. So now towards the student journey in IMU, unfortunately, I am the COVID batch student where I started my whole uni life right in front of the laptop. All the classes were held online and physical classes are really rare for my batch. It's like, I think within 20 times, yeah, that would be possible as well. And most of the people would think that, yeah, a stereotype, which is that online classes are really not helpful or not good for a student. But in IMU, we are really well supported. Why do I say that? First is the faculty, which plays a big role in giving full support for our learning. For information, the whole faculty in dietetics are all good mummies. They are very caring, nice, and easy to approach. Whenever you have any questions, they are more than happy to help and share. So this enables an effective and happy learning environment. Next, all topics will be followed by a tutorial and consolidation. So in this session, you are able to get some hands-on experience, a chance to clarify questions or concreting the learning points so that you can understand the topic even deeper. And also the lecturers, they are very, very willing to share with you their experiences or any valuable insights. So last but not least, the resources are readily available in the eLearn page. Extra information which is related to the topic are part under the respective topics. So there's one big benefit that I'm truly grateful of is the recorded lecture video. Because of the COVID times, after the COVID times, a lot of lecture are recorded in a video version so that you can always watch over and over again or play back as many times as you want. And well, it is a really good thing where you can learn and study at your own pace. Yeah. So nevertheless, as a big teacher here, I'd like to advise all of you to practice self-learning. In university, lecture slides would not give you everything that you need to learn. So don't limit yourself by only reading the slides, but explore more through the internet. But then the knowledge should be obtained from reliable sources. All right, so physical class, which is really, really rare. I only got a few pictures of it. So the physical classes were reactivated immediately once everything is okay for those important subjects or to support a better learning. So for example, some of the tutorials, consolidations, and most importantly, it's the practicals and projects which needs to be carried out physically. Also, we do field visits to the hospital or institute to understand and explore more on the different fields in dietetics. So the most fun thing is that we dietitian can go to the kitchen during our practicals. This is, I think, the most fun thing that I had been doing in IMU for physical classes. So next is the opportunities to grow. Well, although I don't know you guys have been went to IMU before or not, it is quite small, but this doesn't limit a variety of clubs and activities having in here. And I always believe that academic is not the only pathway that allows you to grow, but extracurricular activities is the right key. It trains you more than that. It's communicational skills, leadership skills, planning, multitasking, and also it stimulates your critical thinking and so many more. With that, you gain more soft skills, which is very crucial nowadays, and it increase your competency. All right, so in IMU, we have many clubs that you could join, which is also suits your interest, or you can also go for something called student ambassador or student representative council election also, which, yeah, it's quite interesting as well. And the most interesting part in IMU Dietetics, I would say, it's the student association of our faculty. We call it as INSA. So we have a lot of activities being carried out there. For example, Malaysia Dietitians Day, podcast, intervarsity event, and so many on. So a sneak peek for y'all, it's not a sneak peek. Actually, it's already given by Kishan. IMU is launching something called Student Diet Clinic. So it is led by a student. So from there, I believe I will definitely learn more than I can ever imagine. So yeah, another thing is that volunteering in activities is also very important. It is a way for you to enhance your social skills and you'll get more good friends there. It's not just dietetics friends. I actually know a lot of friends like pharmacy students, medicine students throughout those volunteering events. So it is also a chance for you to know more future healthcare professionals. Yeah. And well, in dietetics, in DN itself, under our module, they also pack a lot of workshops or talks inside our modules. So by there, you can actually meet a lot of dietitians working out there, and they would share about their journey with you, which will increase your horizon. Yeah. And well, yeah, in other words, a lot of linkages have already been low-key done by IMU. So you had the chance to know more dietitians out there, or even know future healthcare professionals in IMU. So take the chance in IMU if you are joining. Well, other than that, it's not just activities in IMU that helps you to grow. It's also important for you to always out. It's not, well, I would say it's always all over your place, but it depends on you whether you want to go and grab it or not. For example, for me, recently I've been joining our MTA conference as a volunteer, which I have been doing MC over there. And also I use up my SAM break to apply for internship in home nutrition. So other than that, don't just limit yourself in dietetics. You can always explore more than your profession. So never limit yourself and do whatever you love and keep growing. Grab any chances that we have in IMU and also use the linkages that have been done by IMU to explore more about your opportunities. So yeah, as I always tell myself, no matter where am I right now, I would have to enjoy my journey. when you're enjoying your journey, you'll definitely shine better than others. All right, so here marks the end of my sharing. So if you have any questions, please feel free to type in the Q&A. And thank you.
Thank you, Yvonne, for that enlightening presentation. Ladies and gentlemen, if you think of a question for the speakers, please type it in the Q&A panel. Next, I'll hand over the session to Ms. Lim Jing Rou. Jing Rou, the floor is yours.
All right. Thank you, Dr. Lee, and thank you, Yvonne and Kishan, for their such inspiring presentation. Just give me a sec, I'll share my screen. All right. Hi, everyone. Very nice to meet you all, and thank you, IMU, for giving me this opportunity to share a bit of my experience studying in Australia. And I'm Jing Rou, and I'm doing my final year of Nutrition and Dietetics in University of Newcastle. So I hope this can give whoever who is keen to study abroad, or maybe a little bit interested, but still not quite sure yet, a bit of insight of what you can expect completing your final 2 years of study in Australia. So feel free to pop your questions in the chat box, and I'm happy to answer them after the sharing. I guess our friend Kishan and Evon have shared their thoughts of doing this degree. For me, it sounds really cliche, but I simply just like food. So after I completed my foundation in science with IMU, I was initially thinking to do Chiro because I think that's actually a pretty cool degree to be able to crack people's bone. And then I came across my senior's Instagram story, and I constantly saw her posting, things like baking, cooking. And I was like, I'm pretty sure that was not the standard from a culinary school, because all the things that, like all the food that she posted, they look pretty average from the appearance. And I also know that she's not a person that would actually study culinary. So I asked her what course she was doing. And then I only figured out this course in IMU, even though I was studying my foundation in IMU. And I was like, you know what, this is actually very interesting. You get to have fun cooking, baking, but at the same time, learn the actual science behind nutrition to help people to make informed choices in their diet and also improve their health in general. And that's why I signed up for this. I thought it would be good to just give you a bit of overall idea where actually Newcastle is, if you have not known already, because prior coming to here, I have no idea where Newcastle is, not heard of it at all. So if you search it up from Google, make sure you type Newcastle, Australia, otherwise it will show up the one in UK, which is better known by most of the people. So Newcastle, Australia, it is a regional metropolitan area. The best way that I can describe this place is it does give a Ipoh and Malacca vibe, very laid back. It is located in the heart of Hunter region, so 3 hours train ride away from Sydney, and bordered by a stunning coastline with beautiful beaches, which you can tell from the pictures on your upper left. And I actually took the pictures. They are raw, no filter at all. This is how beautiful Newcastle is. Unlike Sydney, where you can expect a huge Southeast Asian population, Newcastle is densely populated with local Australians. So English is definitely the main language of communicating. The university that has partnered with IMU for this nutrition and dietetic course is obviously University of Newcastle. And within Newcastle, it has 2 campuses, so the Callaghan campus and the City campus. I don't really have a picture of the Callaghan campus, but if you can tell from this map, it is absolutely huge. You can easily search the campus video from their website, but I can tell you that it's that big that I can still easily get lost in the campus now. Whereas the one here is the City campus. It is mainly for the business student. So we mainly go to Callaghan campus for our classes. So with the credit transfer program, it is a 2+2 program. So I did 2 years of study with IMU, and then I continued my final 2 years in Newcastle University. And I think IMU really prepped us well, and with the skills and the knowledge that we learned with IMU in the beginning 2 years, is definitely transferable. I have no issues, adapting like the difference in syllables when I first came here. For third year, in Australia, it is still a coursework-based year where you get introduced to different areas of dietetics such as clinical, public health, food service, and also the nutrition language. So just like how doctors, they have their own language, we as dietitians, we do speak our language as well. Aside from that, we also get some observation placement in third year to give first a bit of taste of what final year is all about. So really, in third year, it's a year of knowledge and skills preparation before they put us into the actual war. So in fourth year, the final year, which is where I am right now, it is a full year of placement. So similar with IMU. All students, they have their own schedule. So some people start around February, some people start around April. Some might get a month break in between, some might just get 2 weeks. For me, I started my first placement in a community diabetes center where I work with people with diabetes and a special focus with women with diabetes during their pregnancy. So I conducted education program, developed resources, and also audited and evaluated the service in the facility. And we also get to experience some of the new technologies to monitor the blood glucose level of our patients so that we are able to tailor that information that we got into our practice. So after I finished that placement, I have a month break where I actually went to Tamworth. So it's a very rural area for my research. And then I started off my clinical placement in John Hunter Hospital in May. So this is the this is the pictures that I've got. Apologies that I don't really have a lot of pictures to show because we can't really take any pictures in the hospital. This is probably the most hectic and exciting placement because you finally get to practice everything that you learned throughout the years and then put everything in place. So you are actually a dietitian. So for the first 6 weeks, I mainly saw patients with heart issues, diabetes, renal. I normally started my day by checking the patient portal flow. So this is like a computer system where you'll be able to see if there's any referral made for you to see the patient. So after seeing that portal flow, I will prioritize my day, what patients that I have to see, what patients that I have to review, and then head up to the ward to conduct my assessment. So with my final 4 years, final 4 weeks, I ended up in head and neck trauma ward. So I mainly dealt with patients that came in for surgery due to head and neck cancer because after surgery, they can't eat orally. So they will require tube feeding. So we have to set up that one. And also patients that admitted with multiple injuries due to accidents to optimize their nutrition intake for recovery. So some of the patients, they will require special diet like puree, thickened fluid diet because those accidents might impact their ability to eat normal foods. So I spend a lot of time in my intervention in optimizing my patient nutrition intake while here in hospital, and also ensure that they actually get that adequate nutrition after discharging home. So we will provide them education, we will set them up with some of the meal subscription plan, or even things like oral nutrition supplements. So there are things like the protein shake where they can easily just drink and get that significant amount of nutrients. We also assess like their food environment and also social history and see if there is any referral needs to be made from other allied health members to make sure that they are safe and they are able to receive adequate nutrition when they get home. So every time after I see a patient, I have to write up the progress notes. So if you can tell from this little picture over here, and that is not actually the end. So the process and also the subsequent tasks also involve a lot of conversation between the medical team, like doctors, the nurses, and also other allied health team members like speech pathologists, family members, and to inform and discuss the outcomes for the care plan of the patient. So I have to admit that being a dietitian is not like a top piece. I came home every day feeling super worn out from talking too much, but at the same time, feeling absolutely rewarding and fun. And right now I'm on my food service placement, also in John Hunter Hospital, and I'm currently working on a thickened fluid wastage project across the hospital. And that is not the end for your final year. We do not have to attend uni in person because, as I mentioned, we have to attend placement based on our own schedule. And then all the studies, they are all online. So it is our responsibility to manage our own time and be able to complete all the university assessment outside placement hours. So besides that, we also have mandatory volunteering and also like continuous professional development hours to complete. And for me, I'm doing research as well. So research here with Newcastle is not a compulsory thing. If you're not doing research, you can take up some other elective subjects to meet the course requirement. So for me, final year is very, very hectic, but then everything should come along very well with proper time management. So the most exciting thing about studying here in Australia is that after you graduate, you are eligible to become an accredited practicing dietitian in Australia, which I think is also recognized by quite a number of countries, and Malaysia and Singapore are definitely the countries that recognize this thing. So there are also more dietetics exposure for some niche areas in Australia if you are keen. So things like eating disorder, neurology, or celiac disease, and also disabilities, because these are the areas that Australia are really expertise in. The second thing I would say is that communication-wise, Aussies love small talk a lot, so I can definitely tell that my communication skills have improved significantly. So in Malaysia, I personally feel that the word of choice can be a bit more flexible when we interact with each other, but people here, they are less directive. So there's a certain level of wisdom in the way that they communicate, which I think it's a really, really good learning. And I also learned how to be independent in most of the things. Speaking about that, the learning style in Australia values original thinking very highly and also encourage creativity, critical thinking, and independence in all subjects. So you can see when it comes to discussion, everyone will actively engage and pouring their ideas as part of the collaborative learning, which took me a while to adapt, but I certainly enjoyed it. So some of the downsides, I guess, is with the inflation, the cost of living, I believe it's definitely affected everywhere in the country. Especially Newcastle is still considered a regional area. The food here is relatively expensive compared to Sydney. Rental itself is definitely cheaper compared to Sydney, but has gone up a little bit from last year. Transport-wise, not very great. It's either you own a car or you have to take the bus, which the fare is not being subsidized for international students. Another thing that I would say is that probably culture shock. Aussies, they are really strict with their time. So if the shop is closed at 2 p.m. sharp, it is and it will. So if you're visiting a doctor, definitely make sure that you make your appointment beforehand and be punctual. Most of the shops close pretty early here. Hence, I would say very limited nightlife, no mama, no supper. My supper here is mainly just the crackers and my Milo. Another thing is that weather can be a bit crazy because I'm not a big fan of cold, so I definitely struggle during winter. The next thing, probably the most important, is homesickness, which I can definitely relate that a lot. There are times where you can feel a bit helpless, you can feel a bit lonely, but I have very good supportive group over here. So if you are keen to study here, make sure that you put yourself out there, make a lot of friends, make new friends, so that you know who to reach out when you need. And the last thing I probably want to share is that with employment, I know people always say, like the grass is always greener on the other side, but that is true. That is not entirely true, but true to a certain extent. So with employment here in Newcastle, it can be a bit challenging because it's a rather small place. But if you are happy to relocate, move to somewhere else, you will definitely have a lot more opportunities. So that's it from me. I'm happy to answer any questions. Thank you.
Thank you, Jing Rou, for sharing your wonderful journey as a student, as well as the employment opportunities in Australia. Right, now we will go to the Q&A session. We have several questions that have been submitted by the audience. Now I invite all of the participants to participate in the Q&A session. As a reminder, if you have a question that you have not yet submitted, please enter it into the Q&A panel, and we will get through as many questions as time allows. We will move on to the first question. What was the most memorable experience of your practicum? So I think for these questions, all the speakers will be able to share.
Perhaps I can go first, Dr. Lee. Thank you for the question. For me, I think I would just use the clinical postings or my clinical placement as the most memorable experience. So it was very hectic, especially in semester 8, but we got to directly be involved in patient management and care. So like whatever you do, how you assess your patient, how you diagnose them, and then what is your management plan you have to actually propose it to the local preceptors or the hospital dietitians, and they approve it, and then you have to carry out that plan. So following up that patient every day, seeing them progress, seeing how they progress, and sometimes not everyone improves. Sometimes there are patients who deteriorate too because their conditions might be too complex. But seeing this progression was very fulfilling. So that was, I think, my most memorable experience.
I guess I can also share a bit of my experience from my clinical practice as well. So I mentioned that I actually work closely with patients with head and neck cancer and also trauma. So I had a patient that came in, and I was the one that prescribed all the tube feeding for her. She had a trachea on, so she can't speak. So all of our communication actually happened on a paper, and that's really, really challenging because you need to keep your questions like really short, just be able to get the most out of it. She was a pretty tough patient, I would say. Most of the time she was refusing like the interventions that we were seeing and would like to put in place. And then she literally yelled at me on the paper and asked me to just leave her alone, things like that. So it definitely gave me a lot of insights on how to work with this group of patients in future. Yeah, so that was probably one of the most memorable one for me.
For me, because I just did my food service placement in Sunway Medical Center, so the most memorable part for me is that because I get involved into the kitchen and also the tray line, every single process of how the food produced in Sunway Medical Center. Of course, I would also be able to send food up to the ward to the patient. So when I was doing the tray line section where I have to go and serve to the ward as well, I actually was in charge in the pediatric wards. So in the pediatric wards, I served the food to them, and there was one boy. He was admitted like about 1 week and more. I see how he gets well with the progression, and also he actually expressed that he likes the food in Sunway Medical Center. So that actually triggers me another insight of being a food service dietitian. Well, as a food service dietitian, the most important thing is that you have to prepare menu for the kitchen to cook it, and also go through the tray line process and serve it to the patient there. So it sort of like give me another idea. Food service dietitian is actually not bad as well. because you can see how patients improve their condition in the hospital, but also you are able to serve them good food. Food is very important for recovery, of course. So yeah, that's my most memorable memory that I have, because of that little boy who always come to me, like ran to me and then say, "Hey, Jite, I have what food today?" Or then I serve the food, then he say the food is nice or whatsoever. So yeah, it's also another career that I would think of lah.
All right. Thanks, Jing Rou, Kishan, and Yvonne for sharing on this. Right. The next question. Please let us know more about the Student Diet Clinic or SDC in developing student skills in their early semester. So I think, Kishan, if you can take this question.
Sure. So thank you for the question. For now, at least, it is actually planned for the intern students, so those in their final year. But I do know that there are plans in the future for junior students to also use this student diet clinic. So there are certain modules like nutrition assessment methods in your semester 2, and then there's something called nutrition in health promotion in their semester 5. So in this student diet clinic, just a brief overview, they would be doing individual diet consultations, nutrition screening. So for the second semester students, I believe they can do some part of nutrition screening, whereby they'll do those further on in the semesters can perhaps do group education sessions. So I think that
Jing Rou for answering the question. Yeah, if I can add some of the modules in semester 4, which is community nutrition and dietetics in community, you will be also using some of this facility in the SDC to give talks to the patients. Right. The next question, would IMU students get to choose their placement settings? And for students who are hoping to do a placement outside Malaysia, how can students apply for that? All right, I think I will answer that question. Yes, students can choose their placement sites, but they will have to submit the name of the placement sites to the lecturers, and we will check if those placement sites are able to meet the learning outcomes of your study, especially for the practicum. Yeah, and for placement outside Malaysia, for the specialized focus area, students will be able to apply for the placement. So they will need to give us the names, and we will also check if the placement sites are able to meet the learning outcomes before allowing students to apply for these placement sites. All right. So the next question, I think Jing Rou, Miss Lim Jing Rou will be able to take this one. So this is with regards to the placement in her final year. Will you be able to pick the location, or is it chosen by the university?
So I think in Australia here, for international students, you will be assigned to local placement. So what do you mean by local placements is that you'll be assigned to placement site just in Newcastle. So because this is one of the limitations where they are considering that as an international students, you might not have the transport and everything travel to different sites, and also their funding for students to be able to attend placement in rural area. It's only for the local Australians. But I would say, even though you are placed in local area, you are able to pick the areas like the, what is that called? Like the locations that you want to work in, like you want to have your internship in. It's just that it would just be within Newcastle. Yeah.
Right. Okay. Thanks, Jing Rou. The next question is also for Jing Rou. As an international student, are there any examinations or certificates that you have to take in order to become an accredited RD in Australia?
Okay, thank you for the question. So this degree, Nutrition and Dietetics by University of Newcastle is actually accredited by the Dietitian Australia So this accreditation allows us to work in Australia and also abroad. So basically, once you pass your final year, it means that you are eligible to apply for the APD status as well as the full membership to be a dietitian in the DA board. So no examinations in Australia, but I'm not sure if that APD status I'm not sure if you need to sit for additional exam before practicing in certain countries with the APD status. Yeah, but in Australia itself, once you graduate from Newcastle, you are eligible.
Okay, right. Thank you, Jing Rou. We will move on to the next question. What was the most important thing you learned during the internship? Perhaps Kishan will be able to share some.
Yeah, thank you, Dr. Lee. So, yeah, I think the most important thing, it sounds rather cliche, but I think it's the importance of effective communication, how to talk to people from, either your patients, other healthcare professionals. So, for example, sometimes some patients may be a little bit difficult. They may be a tad bit stubborn. So the onus is on you to use whatever you have actually learned, those effective education and counseling skills to actually break down these barriers, to empathize with them, to connect with them, so that they can actually, accept or try to make certain changes in their, daily life or, in their lifestyle and food. So that is one thing. Another thing is regarding your communication with other healthcare professionals. So there are times where you have to actually propose a plan to the doctors in charge. So here, your knowledge, and you have to have a very solid foundation. You have to be very confident when you're presenting your plan. And, there has to be good justification of why you want to do it. And you have to, tell it in a very organized manner so that, they understand and then they can accept and proceed with the plan. So good communication skills, I think that's the most important thing. I learned how to talk to people from various different fields. Yeah,
I can't agree anymore with what Kishan mentioned just now. Communication, definitely. I would probably say something is that the things that you have to be curious, you have to be resilient, and then humble to accept any challenges. So during internship, I would say you are most welcome to make mistakes because that is the part of learning. But being able to reflect on your mistake and also constantly seeking for feedback from like your supervisors will definitely make you a better dietitian and also a better person. And all of that actually build you as a person as well, not just academically, but then your interpersonal skills, which I believe is most of the employers are looking right now.
For me, I totally agree with what Kishan has mentioned. Communication and curiosity is really important when it comes to internship. Like for me, I was going for my first internship last 2 months, right? So it's a time where I used up all my knowledge I've learned in the slides and lectures into real practice session. So that's a part where you need to treat yourself instead of a student anymore. You have to see yourself as a real dietitian out there so that you can learn more than you think. So yeah, that's the most important thing that I have learned in my current internship.
All right. Thank you, Kishan, Jing Rou, and Yvonne. Yeah, we will take another question. How long will it take to study dietetics in Malaysia? Yeah, this program in IMU is a 4-year program and the intake will be in July and September. Yeah, the degree qualifies you to become a dietitian and you're eligible for the registration with the Malaysian Allied Health Professional and the HPC. And we have time for one last question. Do you have other universities for credit transfer besides University of Newcastle? Okay, I think I will answer this question. Yes, we have the University of Griffith in Australia and University of Rutgers in USA, for credit transfer besides University of Newcastle. So as we draw this remarkable session to a close, I extend my heartfelt gratitude to Mr. Kitchen, to Ms. Yvonne Lee, and to Ms. Lim Jing Rou for sharing your insights with us today. The insights provided today will undoubtedly guide us in transforming our dreams into reality in the field of dietetics. To all our attendees, thank you for your active participation and thoughtful questions. We hope you have gained valuable insights into the journey of becoming a dietitian and the various aspects of this rewarding profession. If you have any additional questions or would like to connect directly with IMU, do not hesitate to reach out directly using the contact information on our website. Thank you for your time and have a restful rest of your day. Goodbye.